One of the most common mistakes people make is confusing Medicare Advantage plans with the Medigap policies. It is important someone understands the distinction between Medicare Advantage and Medigap policies because the benefits are vastly different. Typically, the price for an Advantage plan is cheaper than that of a Medigap policy, but your out-of-pocket responsibility is greater. In some geographical areas and for some people, Medicare Advantage plans work great, but they are not appropriate for everyone. Remember this rule of thumb: don't buy a plan for the premium. Buy it for the overall value, which includes benefits, premiums, and provider network. Understand what you are buying. Most of our clients who live in rural areas prefer to buy a Medigap policy if they are medically qualified. These plans are more widely accepted by doctors and they leave very little for the insured to pay out of their own pockets. In some areas, Medicare Advantage plans are a more attractive option. These areas commonly include urban areas where there are competing healthcare systems. In the event that someone cannot afford or does not qualify for a Medigap policy, an Advantage plan may be the most attractive option. For these folks, Medicare Advantage plans might be a good alternative because copays are more affordable than original Medicare alone. Also, Advantage plans do provide an out-of-pocket limit each year. The out-of-pocket limit can be quite high, up to $10,000 per year unless you qualify for Medicaid. You should always consider the plan's network because some doctors may not accept these plans. Medicare Advantage plans contain all the basic benefits of Medicare Parts A, B, and sometimes D. There are several types of Advantage plans, but the two most common to be discussed are HMOs and PPOs. HMOs are health maintenance organizations that pay fees to particular medical providers to treat plan members. Members are required to pay copays and some coinsurance until they reach the annual individual out-of-pocket limit. HMOs are generally more competitive in large metropolitan areas where several hospital systems can compete for patients. The doctors and hospitals in the plan have to agree to provide member services for a lower cost, and in return, the plans refer patients to the providers. HMO members are assigned a primary care doctor who must be seen before being referred to specialists. The primary care doctor is responsible for overseeing the care of the patient. HMO members must see plan doctors to receive benefits, except in emergency cases. This can be a big disadvantage if your provider is not in the HMO. PPOs are preferred provider organizations. These are Medicare Advantage plans with a network of providers who have agreed to discount services for the plan, but the plan still provides benefits if you go outside the network. However, going outside this network may require additional costs and exposes you to higher out-of-pocket limits. The premiums of HMOs and PPO plans can be very low, and in some cases the premium can be zero, making them very attractive from that standpoint. If you opt for Medicare Advantage, you must be comfortable with the potential out-of-pocket cost and restrictive networks.